your shoulder. And I like to draw it for patients, you know, from the bones out. So the shoulder is a complex articulation. There's the socket, there's a ball, there's a separate joint above that, which is the joint between your collarbone and your shoulder blade. This is your clavicle or collarbone. This is called the acromion, which is part of your shoulder blade. Together we call that the AC joint. The rotator cuff is a group of tendons that surrounds the shoulder. What we should see on an MRI scan is a thick black structure that comes all the way out and dovetails into this bone just like that. And what we see in your case is a classic small but full thickness rotator cuff tear. So these people see the reports and they go, oh my God, it's a complete rotator cuff tear. Well, it's a relatively small portion of a broad flat tendon that it has a good prognosis for repair. So if you look at your scan here, what we see schematically is that your tendon stops there. This bone out here has a little bit of tendon still left on it. This part of it right there. So the tears a lot of times occur in what's called the critical zone, and there's just real poor blood supply here. And there's a possibility there may be still one layer. It's a 5-layer structure. So this little black thin line that's a little bit darker than the bone there may represent that instead of this being a complete tear, it's just a really significant partial tear. Either way, it's going to functionally act like a complete tear because you can see it's retracted. You can see this kind of a bow here. It's like taking a rubber band, having it out like that, and then letting it go. You're going to have this kind of rebound kind of retraction. This joint between the collarbone and the shoulder blade oftentimes puts pressure down on the muscle in that area, and that increases the pressure there. But muscles contract, that's what they do. So they tend to pull the tendon farther and farther away from the bone. So for somebody that's 60, active, likes to ski, if it's hurting, we know that that means the tear is progressive and it's going to get bigger with time. And right now, your prognosis for repairing this is excellent. If you said, I can't have surgery right now, am I losing anything by not doing anything right now? As long as your pain, if let's say your pain completely settles down, goes away, then it may be that this is going to be stable and you wouldn't lose much by waiting. But what we do know from the natural history of these injuries is that if you've got a significant partial tear, in your case, a real significant partial tear, probably a full tear, that if you have persistent pain, that means it's getting progressively worse. So my recommendation would be to go ahead and get it repaired. But in terms of the injury was in ski season, so February or so?
January.
January, so it's about 4 months out now. The scan is dated in April, so there's not too much rush to do it. But if you're still having pain with it, I would recommend doing it kind of the concept of sooner rather than later. Bone off. If there's arthritis in this joint, which I think there is, we'll take a little bit of bone off either side of that joint. And then we're going to take this tear here and we're going to try to bring it back as close to where it came off as possible. And the way we do that is by burying the bone down that's underneath that area, because the bone marrow is what heals things. And then we use an anchoring device into the bone there with some sutures attached to it. And those sutures go out through this part of the tendon, and then those are usually attached to another anchor that's put in like that so that the tendon is compressed against the bone. Kind of like if you look at my hand here, this is your tendon, that's that knuckle of bone. We try to compress the tendon against the bone. It's a relatively small tear. We wouldn't have to immobilize you for more than about 3 weeks. Usually do it with a small pillow, but we probably would want to keep it relatively still for 3 weeks.
So what do you mean a small pillow?
It's a sling that has a small pillow. And it's a device that'll just kind of keep your arm away from the side of your body a little bit. It's not, this is not one of those tears like you may have seen people out there, maybe in my waiting room, because I do a lot of these really big tears that are chronic tears and hard to fix. And we have to put them up like this sometimes. Yours would be kind of down at your side but I usually use the pillow because it takes a little bit of the tension off the repair. It's a little bit less painful. And sometimes we make that final decision about what we're going to do rehab-wise at the time of the surgery. Because it really depends on the quality of your tendon, which I think is going to be really good. The quality of your bone, which should be really good. And so we might be able to move it with some controlled exercises relatively soon.
Okay.